welcome to Consider the Alternative, a show where we'll explore different alternative healing methods. I'm your host, Laura Duffy. I'm a massage therapist and have been for the past 9 years, both at AT&T in Basking Ridge and in private practice doing therapeutic massage for women in Hillsborough. That's my area of expertise. If you have any questions regarding massage therapy or any other alternative healing method, please write to us at Consider the Alternative, P.O. Box 443, Belmead, New Jersey, 08502. And if we don't know the answer, we'll book a guest who does. Our first question for today is from Audra in Bedminster, and she'd like to know, how do I tell if an acupuncturist is qualified? And for that answer, we'll go to today's guest, Dr. James R. Golding of the Somerset County Chiropractic and Acupuncture Center. Welcome, Dr. Golding.
Thank you, Laura. It's an honor to be on your show, and it's wonderful to be here, and I think that it's good that you're informing the general public about more about alternative medicine. In regards to your question, I've been in clinical practice in the Somerville area for 20 years, and I'm a chiropractic physician and board-certified acupuncturist. I'm also the president of the New Jersey Association for Acupuncture and Oriental Medicine. New Jersey just so happens to be the single best place to go to see an acupuncturist. New Jersey has the highest standards for acupuncture treatment in the world. It has a prerequisite of 4 years of a bachelor's degree ahead of prerequisite to going to acupuncture school, and then acupuncture school is a 3-year full-time school. So there's a minimal of 7 years of training associated with acupuncture. What you should be looking for is that you should be looking for a practitioner that is board certified by both the SCCA and the New Jersey Board of Medical Examiners.
Okay, very good. Now, Steve from Piscataway asks, is there danger of infection?
Acupuncture is an invasive tool. Acupuncture is an invasive tool, and you know, anytime you're using needles, the risk is potentially there. It is very, very minimal because all acupuncturists use single-use disposable sterile needles. A person, an acupuncturist could use autoclaved needles, but it is so rare nowadays because the pre-sterilized needles are a big concern to people, and they can be purchased in that manner. So everyone pretty much uses the pre-sterilized needles. Also, we have a whole course on what's called clean technique. So there's protocols that the acupuncturist follows that allows for the risk of infection to be low to no.
Very good. Now, Lisa from Bridgewater asks, how does it work?
Acupuncture is a tool of balance. And originally, acupuncture is 3,000 years old. And it started as a system of observation by the Chinese in attempting to figure out how the human body worked. As a result, they found there was a correlation between certain pains and symptoms that occurred and tendernesses that occurred on the superficial portion of the body and problems that a person was experiencing internally. The way that acupuncture works is that there are certain points within the body known as acupuncture points, and they are located on meridians or channels. These channels within the body have been mapped over a long period of time, over thousands of years, and we've found out that sticking a needle in that particular location elicits a certain physiological response in the body. Acupuncture, being a tool of balance, can either bring energy into an area that has deficiency or bring tightness or constriction out of an area by pulling the energy out of the area. Acupuncture also, the process is a natural anti-inflammatory process. So when we're treating chronic pain or arthritic conditions, the needling process creates chemical changes within the body that makes the body manufacture its own form of anti-inflammatory, which is measurable in the body for 6 to 8 months after the process. Also, it lifts up what's called endorphins. Endorphins are a natural pain-relieving hormone and a hormone of well-being within the body that has a lot of physiological benefits. Also, it helps to stimulate nerve healing. It can relax muscle spasms and tension, and normalizes the flow of nutrition in and out of a given area.
Very interesting. Well, Donna from Hillsborough asked, can it help depression?
More and more, acupuncture is being utilized to assist in the treatment of mental disorder. A study was done recently that showed a 67% effectiveness of utilizing acupuncture in treating depression. Now, it's not to say that acupuncture is going to take the place of counseling or psychological help if a person needs that, but the actual feeling of depression can be uplifted through the process of acupuncture, and depression is in the top 10 things seen by an acupuncturist. So because acupuncture is enjoying a lot of popularity as the #1 growing alternative medicine in the United States now, more and more people are utilizing this because there's no side effects. There's no downside to utilizing acupuncture. And even in cases where a person is severely depressed and needs medication, getting acupuncture cuts down on the amount of medication needed. So then again, it has a role in the treatment of depression, whether the person needs medication or not.
Yeah, I think we'd want to encourage people that alternative doesn't mean exclusively
right, or abandoning.
Or abandoning other traditional medical techniques, that it can be complementary medicine.
Right.
I think that's what you're trying
I think that people are starting to come to that understanding where, as if they don't want to make a giant step into major lifestyle changes, they're becoming more and more open towards other options that don't have the downside to it, that sometimes either medicating and side
like
effects,
with morning
things like
sickness,
that.
perhaps. I know some women try acupuncture for morning sickness.
The National Health Institute they just completed a 5-year study on acupuncture and its efficacy. And the two things that they found that acupuncture treats best are, #1, morning sickness, and secondarily, the treatment of side effects associated with chemotherapy.
Wow. Well, I'll be sending you my prenatal clients that have morning
It takes
sickness.
roughly anywhere between 2 and 3 treatments. It's not an involved process. It will, requiring minimalistic treatment. A lot of I see a lot of women for it, and for some women, getting that treatment is very necessary because they have morning sickness so bad that it's causing deleterious health benefits for them and for the developing child because they have it that bad.
Yes, for nutritional purposes. Well, perhaps the most asked question is, does it hurt? And for that, we're going to a demonstration on me. So stay tuned. We'll be right back. Hi, and welcome back to our demonstration of acupuncture. Dr. Golding has asked me if I have any presenting problems. One of the things that I have that many people have at this time of year is allergies. I cough, I sneeze, I blow my nose. Can you help me, Dr. Golding?
I'm most certainly going to try my best. And tonight we're going to treat the sinus condition, and also we're going to address the underlying stress and tension that you had been complaining and experiencing.
Absolutely.
An average experience at an acupuncturist's office goes like this. A person will go in and they will fill out a forms that deal with their complaint sequence and other symptoms and other bodily related symptoms. Some of the questions an acupuncturist may ask during the course of the history or interview seem to drift away from what your complaint sequence is. But what happens is that acupuncture and traditional Chinese medicine, meaning Chinese herbal medicine, incorporates a holistic approach towards their outlook on one's health. Since it's a tool of balance, it's a tool of bringing the body into harmony, it's not just concerned about treating health conditions, it's concerned about bringing that reestablishing normalcy to the body. So when we talk about we're going to do specific treatment for your sinus condition, but we're also going to bring on an overall, healthy aspect towards the way that your body functions. So Chinese medicine truly had developed this whole aspect of holistic medicine, or a total body approach. After the interview and history takes place, other forms of diagnosis in Chinese medicine would incorporate the use of pulse diagnosis. Pulse diagnosis is diagnosis that is taken by feeling the radial artery along this position in the arm. What we're looking for is we're checking for 27 different qualities that deal with what's going on in a person's body energetically. It tells not only the pulse rate and how it is, but we're checking for 27 different qualities that give us an indication of whether an organ system within the body is weak, or whether their metabolism is fast or slow, whether there's heat in the body, whether the person's pregnant, whether they're under stress or tension. All of this can be told through this particular form of diagnosis. This is the primary form of diagnosis used in Chinese herbal medicine. Like if someone were to go into Chinatown in the city and visit a Chinese herbal doctor, they would take their pulse and write out a Chinese prescription for herbs from that pulse. So we're getting information on how the body's metabolism is reacting through pulse diagnosis. The secondary aspect that we're going to do is that we're going to look at the tongue. Laura, let's see your tongue. Once again, let's see that tongue. Come on, out with it.
Okay, again?
Okay, yeah, once more, because I'm going to tell about you from your tongue. If we look at her tongue, we see ridges in her tongue. This ridges in the tongue indicates what's called dampness within the body, fluid retention, and indicates a deficiency of qi. Deficiency of qi is your body, what the Chinese refer to as your body's natural energy. And qi deficiency will show up as a scalloped or ridged tongue. Out again, please. What we see is a slightly yellowish coating to the tongue. The yellowish coating to the tongue also indicates the fact that there's heat symptoms within the body. This would go concurrent with her sinus condition that she's experiencing, because normally the temperature will rise up. Also, we know that, once again, we know that her tongue is pale. A pale tongue gives us an indication that there's also a deficiency condition going on, and that the heat in her body is recent heat and not long-term heat, because her tongue is not red. Her tongue is pale, but the coating of her tongue is yellow. Also, it's broken down into different regions of disharmony in different areas of the tongue. There's volumes written on just tongue diagnosis, and it's extremely accurate when the practitioner learns to interpret this information over a long period of time. So we have the pulse diagnosis, tells us what's going on metabolically. We have the tongue diagnosis. It tells us what's going on statically within the body. So that's not changing like with your pulse rate. That's the indication of a longer-term weakness. So that's two ways in which we measure. The third, let's have you come and stretch right out for a moment, will be palpation. Acupuncture points that usually need to be needled are tender to palpation or touch. Also, it's part of the diagnostic process, because within Chinese medicine, a sinus condition may be caused by many types of, maybe a part of many other problems. So we try to differentiate the syndrome, or the TCM, what's known as a traditional Chinese medicine diagnosis. So what we're going to do is that we're trying to get information, and is this point tender on you?
Yeah.
to palpation. This is known as liver 3, frequently tender on Americans because we're all stressed and tensioned and all tightened up all the time. There should be a permanent needle stuck in this point on all Americans so that we chill out. But this is indicative of weakness within or constriction in what they call the liver channel of the body. One primary point for diagnosis is here for sinus conditions. Is this tender in this region?
Not
so
really.
bad? Okay. How about here? Little?
Not really.
All right. How about at this point?
Yeah, a little
Okay.
bit.
How about
Yeah.
here?
Definitely
This is known
there.
as spleen 6. This is the meeting point of all what they call the yin meridians of the body, and that's the meeting point of all of the organ systems energy circuit. How about up into here?
Yeah.
Okay.
The
All right.
medial aspect.
All right.
the
How about
inside.
at this point here?
Not too bad. A little
Okay.
bit.
Very good. Now, in coming up into here, when I palpate or touch into here, is that point sore?
Not too much. A
Okay.
little bit.
We're going to be
deeper.
needling this point in just a few moments, regardless of the soreness, because this is known as triple heater 5. That is the singular primary strongest immune response system in acupuncture. So needling there lifts up white blood cell count immediately.
It doesn't necessarily feel sore, but it feels like clogged. I can't describe
Okay.
it, like
Like a-
congested in the muscle. Yeah.
Okay. How about here?
Not too bad, but a little
Okay.
bit.
How about at this point?
No, not
Okay.
there.
All right. How about along this margin?
Yeah,
Okay.
there, totally
This is
there.
this is what's called the large intestine channel. The large intestine is internally related in Chinese medicine to the lung channel, and the lung and the whole aspect of breathing and sinuses are interrelated. So when we get too much energy into the lung channel of the body, it needs to be balanced out by needling along these points for the large intestine. And frequently in practice, the Chinese correlate symptoms together. Many times people think they're falling apart because they have colitis, and they also have breathing problems, and they have allergies, and they say, I got this, and I got this, and I got this. But within Chinese medicine, frequently it's just one singular problem. And a person comes in for one thing, and they undergo acupuncture, and all of a sudden everything else clears up.
Oh, well, that's
and
good.
it's happy. The other thing that we're going to do is that we are going to palpate her abdomen. Now, within Chinese medicine, this is known as Hara diagnosis. And by palpating certain reflex points within the abdomen, and I'm not going to expose that right now, gives us an indication of verification for weaknesses within certain organ channels of the body. Here I have a acupuncture model that's demonstrating all of the meridians in the body and the channels. There's 365 regular points within the body that we would needle in acupuncture, but there's also hundreds of other accessory points that have exceptional ability. There's points on top of the head that affect memory. They're not on regular channels, but by needling them, we stimulate the memory process. Also, what we're going to be doing in just a few moments is that we're going to be doing auricular medicine. This is a separate form of acupuncture that is separate from meridian-based acupuncture, because all of the sensitivity regions in the ears are hooked up to a nerve called the vagus nerve. When we stimulate that certain portion of the vagus nerve, it reflexes into the body, into given regions. So there's whole areas that are diagnostic for within the body that relate to the ear and the needling of the ear itself. And we're going to be doing that in just 1 second. So what we have right now, from what the information that I've gathered, is that acupuncture is indicated. She has a condition known as deficient spleen qi, and she also has what's known as an external wind invasion. That means that evil forces, such as bacteria, and her diminished ability to fight against these defenses from the outside, these forces, need to be expelled from the body, and that's what we're going to be doing. Prior to the needling process, we we swab the areas that we're going to utilize acupuncture needles with alcohols as a cleaning process. This is all part of what they consider to be clean technique. All of the acupuncture needles that we use are single-use disposable sterile needles, as stated before, and they're individually packaged. I would like to show you for a moment different types of acupuncture needles. They vary in size, anywhere from 1/4 of an inch to up to 4 or 5 inches, depending on the nature of the areas in which we're needling. We also have acupuncture needles that also will stay in the body for a prolonged duration of time for stimulation, depending on what type of process needs to occur. If a person's coming in for weight loss, we may stick needles in their ears that may stay in there for weeks. Oh yes.
Wow.
So because we want to continually depress the appetite and stimulate the metabolism. So we don't want that process going on strictly while they're in the office. Now we're going to start the needling process right now. And we're going to start out by needling liver 3, which will initiate the free flow of energy in the body. What you'll initially experience, and I'll initially speak for her, and then she will speak for herself, is that she will feel what is either a dull ache initially come into the point.
I immediately felt that on this right leg. I didn't feel it on the left leg.
There'll be a dull ache come into this point, and then gradually the person will have a feeling of anesthesia that will come over the body. And that is a very tranquilizing sensation. An acupuncture treatment takes anywhere in between a half an hour and 45 minutes and is rendered in a very relaxing setting and a relaxing environment. The more a person is able to relax, the easier, the more their body is better and more able to accept the acupuncture process itself.
Now, every time you're touching me, you're putting a needle in? Because I'm not feeling it.
Because I'm smooth.
Okay.
Acupuncture we can also, this is called regular acupuncture needling. We can also utilize small electrical currents that we put through the needles that is known as acupuncture, electroacupuncture, that will also help to accelerate the effect of the needling process itself. But for something like sinusitis, we don't need to utilize electroacupuncture. It's not necessary.
What about things like the moxibustion? Is that where they light it on fire?
Yeah, moxibustion, or the heating of acupuncture points by the burning herb mugwort, is utilized for a person that has a deficient condition. Let's say someone comes in and they have chronically cold feet, or they're diabetic, or they have some type of neuropathy going on that may be dealing with poor circulation. What we'll want to do is heat the acupuncture point as opposed to using needles to stimulate. Also, what we'll utilize in my office is laser acupuncture for those that are needle shy, or we'll use magnetic acupuncture, which for people that don't want to have their body punctured. And so it's the application of the process of acupuncture and Chinese medicine can be utilized for you don't have to have the needles to undergo the process to get better, which is the point that I'm trying to make there.
No pun intended. I do know people that are needle shy, so it's good to know that there are alternatives.
That's the primary reason why a person wouldn't undergo acupuncture, is because they think that acupuncture hurts you.
Well, probably if I had seen you doing it, I might have been more leery, but truthfully, I really didn't feel it. So I can answer that question. It doesn't hurt.
Well, I'm happy at that.
Me too.
Next, we're going to be needling points in the ear. We're going to needle a point known as Shen Men, which brings on a very tranquilizing sensation in the body. Next, we're going to needle the nerve point for the parasympathetic nervous system. This will also quiet the blood vessels, normalize the blood vessels in the sinus region. There is a tremendous amount of interest in auricular acupuncture, or what's called auricular medicine, by medical doctors who have established this correlation between the vagus nerve and the physiological functions within the body. We do needling on the face, but it's not necessarily, it doesn't necessarily have to go heavy with needles on the face. But since she's looking for relief of her acute sinus condition, we're going to be doing needling, direct needling.
So when I wake up tomorrow morning, should my allergy symptoms be alleviated? Can I look for that quick result?
Sometimes it happens even quicker than that. It's not. Wow. It's not a situation. It's very difficult when we're dealing with a problem that's chronic. Any type of chronic problem, there's usually there's not overnight or quick fixes with chronic problems, chronic pains. But when we have a very, very quick something that came on quickly, that type of an acute condition can be changed very quickly through acupuncture.
Well, that's good to know. I hope everybody enjoyed our show today. Ah, thank you. Whoa. Who knew? And I'd like to thank Dr. Golding, first of all, for educating us, and secondly, for making his points painlessly. I hope you've learned something today, and I hope this information will give you more choices. Thank you, and until next time, I hope you'll consider the alternative. Bye-bye.